Hello, I'm Eric Strong from Strong Medicine and Stanford University, and today I'm discussing Andrew Huberman. For those of you unfamiliar with him, Dr. Huberman is a neuroscientist, also from Stanford, who has a very prominent presence on social media and who currently has the most popular health podcast in America. Now, before his legions of fans descend on my channel to leave angry comments after rage-clicking this video, let me be clear. I am not going to be disrespecting Dr. Huberman. This is not some epic, broad takedown video in the vein of H. Bomber Guy or Professor Dave Explains, but I do think he has a misconception about health, or at the very least, he propagates this misconception online, as illustrated by two tweets of his from last week. Let's tackle them one at a time, and then discuss their connection. I think it's fair to ask if the MD or scientist or public health official saying to do X or not do Y looks and sounds healthy and vital. I avoid going to a dentist with bad teeth. What do you think? I sense diverging opinions on this. First, this tweet makes me wonder, by what standards is Dr. Huberman judging whether a person looks and sounds healthy and vital? As a patient, he's not performing a physical exam on his doctor or on some random public health official. He hasn't taken their medical history or examined their chart. What he can do is assess how lean or obese they are, how muscular they seem to be under their clothes, how confidently they speak, and if he meets them in person, he can assess, how firm their handshake is. But that's really it. However, people's external appearance and internal health can be vastly different. A doctor can move slowly around their clinic because of an old injury that has nothing to do with their overall health. They can look pale from applying, a lot of sunscreen, or maybe because that's just their natural skin tone. Maybe they're obese because of genetics and their diet is playing only a modest role. Maybe they've made a deliberate decision to not lift weights because they'd rather spend that time with their family or on their work. Sacrificing exercise for career advancement might not be the decision we would make for ourselves, but that doesn't make it an invalid one. Conversely, a person can seem externally healthy and vital, yet be unhealthy under the surface. Your healthy and vital physician can be hiding substance abuse or an LDL of 240 related to poor diet or unlucky genetics. They can have mental illness or occult cancer from the smoking habit that you don't know about. Maybe they had cardiac bypass surgery last year. If the surgery went well, how would you know that just by looking at them? What I found the most frustrating about this tweet, though, is the implication that a medical professional who does not look or sound healthy must not have reliable health advice because if they knew what they were talking about, they would necessarily be fit and robust, because ultimately we are all in total control of our own health, right? But hold that thought. Here is tweet number 2. I am convinced that the 8 pillars of mental and physical health are sleep, sunlight, exercise, stress management, relationships, nutrients, oral health and gut microbiome, and spiritual grounding. So aside from oral health, which feels a little out in left field, it may seem hard to argue with the rest of this list in the sense that these are all things that are important. I'm a physician and I wholeheartedly endorse good sleep, getting outside, regular and varied exercise, a healthy diet, etc., etc. The problem here isn't what's included, it's what's excluded. I'd argue that Dr. Huberman misses all of the most important factors for mental and physical health. Genetics, financial stability, including housing and food security, having had a stable home during childhood, meaning the combination of a loving family, a good education, and an actual physical home that was warm and dry. A sense of personal safety in one's everyday life, meaning everything from an absence of intimate partner violence to not living in a literal war zone. Access to health care. And last, the single biggest overall factor, luck. So, in what way do my pillars of health differ from Dr. Huberman's? Dr. Huberman's are all things that the individual can mostly control themselves, while mine are all things that are mostly outside the individual's control. Now, it's true that these two lists are not totally independent. Whether a person can get good sleep is dependent on feeling safe, and whether they have time to exercise or can afford nutritious food is dependent on having enough money. But Dr. Huberman's list, as he's constructed and worded it, makes it seem like your health is entirely in your hands. If you choose to be healthy, you probably will be, with the implication that if you aren't healthy, you probably made bad choices along the way. I suspect Dr. Huberman doesn't actually believe this, but the connection between these two tweets, the misconception here, is control. How much you can control your own health on a day-to-day basis with your day-to-day decisions. Here's the unfortunate reality that a lot of people find hard to swallow. Most people are healthy or unhealthy despite the day-to-day decisions we make. The factors which most significantly influence our health and ultimately our longevity are things outside of our control. Where were we born? What genes did we inherit? How wealthy was our family when we were kids? Because that's the most important determinant of how wealthy we are as an adult. And how lucky have we been? Now, I don't want this all to be criticism of Dr. Huberman. I do think it's important for physicians and scientists to be promoting healthy lifestyle choices because they do make some degree of difference that will make most of those changes worthwhile for most people. If Dr. Huberman's podcasts and tweets get people to sleep an extra hour, start going to the gym, reduce their consumption of ultra-processed foods, and even brush their teeth a little more, then that's great. My issue is that we also need to be honest and transparent regarding the degree of benefit those changes will likely bring. I understand people who feel differently about this, but knowingly exaggerating benefit to trick relatively unmotivated people into changing their behavior, that doesn't feel okay to me. In medicine, almost no intervention is as effective as people think. It's true of prescription medications, it's true of most surgeries and invasive procedures, and it's true of lifestyle changes like diet, exercise, and sleep. If Dr. Huberman's pillars of health make you feel better, look better, and improve your self-confidence, that is awesome. You should keep doing them. Just temper your expectations as to how many years they'll be adding to your life. How long we live and how healthy that life will be are more outside of our control than health and wellness influencers typically imply. If you come across a person in life who looks or sounds unhealthy, please do not assume it was because they made bad lifestyle choices. Whatever negative thing you are observing is probably not their fault. There is, however, one huge exception to this whole discussion, a fundamental pillar of health, the benefit of which people underestimate, and which is to some extent within your control. Quitting smoking. Smoking is overall the largest preventable risk factor for early death. To his credit, Dr. Huberman's podcast has talked about smoking, including advice on how to quit. So if that's something that's relevant to you, you should check those episodes out.